Scientists today are studying the possible causes of mood disorders, but most of them agree that there isn't a single cause for mood disorder. Rather, there are many factors that work together to produce the illness. The factors, we can group them into three groups. First of all, there's the biological factors, the psychological factors, and the social-cultural factors. We start off with the biological factors. Bipolar disorders and depressive disorders tend to run in families, but bipolar disorders have a stronger family link compared to depressive disorders. And next, if we look at the brain, most parts of the brain are underactive. For example, the amygdala, which helps in storing and recalling emotionally charged memories, sends a signal to the prefrontal lobe, which in turn sends a signal back to it when the source of the fear is gone. But in depression, the prefrontal lobe does not send a clear signal, which causes extended rumination of sad events. In other words, depression. And there's also another factor that we can look at is the imbalance of the monoamine transmitters. What are monoamine transmitters? These are serotonin, dopamine, and norepinephrine. If there's an imbalance, this could result to mania or depression. Lastly, hormones. Hormones play a huge role in the biological factors because an excess of hormones produced by the neuroendocrine glands may lead to imbalance in the monoamine transmitters. Secondly, we have psychological factors. We try to explain it in a psychodynamic way. Depression comes when an individual has childhood experiences that prevents the development of a positive sense of self. For example, an individual becomes too overly dependent of approval of others due to an incorrect upbringing by the parents. Next, there's what we call learned helplessness. For example, if an individual experiences a prolonged state of stress, he eventually becomes helpless and depressed. One good example is maybe if you put a dog inside a cage and if you electrocute him, he will eventually try to escape. But due to the prolonged stress that he experiences, he would eventually stop trying to escape from the cage. Second, we have cognitive explanations. This is where optimism and pessimism comes in. As we all know, optimistic individuals have better physical and mental health. Depressed individuals rarely think of positive thoughts. That's why they're more prone to these mood disorders, especially depression. There's also what we call catastrophic thinking. This happens when an individual magnifies the significance of a particular situation. For example, if I get fired from my job, because I have catastrophic thinking, I would think that after I get fired, I won't have any job. There won't be companies who would get me. So basically, you're just magnifying the gravity of the situation. Lastly, we have social-cultural factors. Interpersonal relationships could lead to depression. Depression might arise from problems which develop in relationships from other people. For example, an individual might not have a very good relationship with his parents when he was younger, and that would affect the occurrence of depression when he grows up. Next, we have socioeconomic factors. Individuals which have low socioeconomic status are more likely to develop depression rather than those who are not. Next, we have cultural variations. To explain cultural variations, I'll give an example. There's a culture that emphasizes more on independence and individuality, and that could isolate individuals from society, which of course would lead to depression due to hopelessness or loneliness. And next, we have gender. Women are more likely to get depressed than men, but that's not the case in bipolar disorder. Men and women have the same probability of getting that disorder, So basically, those are the main causes for mood disorders.
Bipolar disorder is a long-term illness that currently does not have a cure, but it can be significantly managed. There are three ways by which we can treat bipolar disorders: through medical treatments, psychosocial treatments, and through alternative treatments. To help control the bipolar condition, mood stabilizers are usually prescribed. Lithium was the first mood-stabilizing medication approved by the US FDA for treatment of mania and is often very effective in controlling mania and preventing the recurrence of both manic and depressive episodes. Doses of lithium should be carefully prescribed as its toxicity is potentially fatal, with side effects ranging from vomiting, diarrhea, weight gain, and other effects involving the kidneys, thyroid, heart, and skin. A complete lithium trial should last at least 4 weeks to test its efficacy and to decide whether to discontinue the intake. Anticonvulsant medications can also have mood-stabilizing effects, such as valproate and carbamazepine. These may be combined with lithium for maximum effect. Psychosocial treatments are also available, and this as an addition to medication includes certain forms of psychotherapy or talk therapy, which are helpful in providing support, education, and guidance to people with bipolar disorder and their families. Psychoeducation involves teaching people with bipolar disorder and their families about the illness and its treatment, and how to recognize signs of relapse so that early intervention can be sought before a full-blown illness episode occurs. Cognitive behavioral therapy helps people with bipolar disorder to learn to change or modify inappropriate or negative thought patterns and behaviors that have been associated with their illness. Family therapy uses strategies to reduce the level of distress within the family that may either contribute to or result from the ill person's symptoms. Interpersonal and social rhythm therapy helps people with bipolar disorder to improve interpersonal relationships and to regularize their daily routines. Regularizing daily routines and sleep schedules may help protect against manic episodes. There are as well alternative treatments for bipolar disorders in situations where medication, psychosocial treatment, and a combination of these interventions prove ineffective or work too slowly to relieve severe symptoms. These include electroconvulsive therapy or ECT and natural supplements. ECT may be used for severe conditions in the psychosis or suicidality of the patient. It is highly effective for severe depressive, manic, and/or mixed episodes. Natural or herbal supplements may also be used, like St. John's wort. This is an over-the-counter herbal product sold mainly for its positive effects against depression.
Antidepressant medications and psychotherapies are the main treatments for depressive disorders. Some people with milder forms may do well with psychotherapy alone. People with moderate to severe depression most often benefit from antidepressants. Most do best with combined treatment, medication to gain relatively quick symptom relief, and psychotherapy to learn more effective ways to deal with life's problems including depression. Depending on the patient's diagnosis and severity of symptoms, the therapist may prescribe medication and/or one of several forms of psychotherapy that have proven effective for depression. There are several types of antidepressant medications used to treat depressive disorders. These include newer medications, chiefly the selective serotonin reuptake inhibitors, or SSRIs, the tricyclics, and the monoamine oxidase inhibitors, or MAOIs. It is important to keep taking medication until it has a chance to work, though side effects may appear before antidepressant activity does. Once the individual is feeling better, it is important to continue the medication for at least 4 to 9 months to prevent a recurrence of the depression. Anti-anxiety drugs or sedatives are not antidepressants. They are sometimes prescribed along with antidepressants. However, they are not effective when taken alone for a depressive disorder. Stimulants such as amphetamines are not effective antidepressants, but they are used occasionally under close supervision in medically ill depressed patients. Antidepressants may cause mild and usually temporary side effects in some people, which range from a dry mouth, dizziness, nausea, nervousness, and sexual problems.